Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 251,338 confirmed cases of COVID-19 in Canada and 80,690 cases in Ontario. Chatham-Kent has 419 cases and Sarnia-Lambton has reported 375 cases. Michigan now has 197,806 cases, with 16,046 cases being in Detroit. Today, we are reporting 15 new cases of COVID-19 in Windsor and Essex County. 3 cases are travel related to Michigan. All 3 work in Michigan. 2 are healthcare workers, and the 3rd works in a non-healthcare setting. 7 people are close contacts of confirmed cases. 3 cases are community acquired. 1 is a local healthcare worker, and 1 is still being investigated. We have had 2,891 cases of COVID-19 since March. 2,745 cases are now resolved, and 70 cases are active and being followed by our health unit. 3 people are currently in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are currently 2 long-term care and retirement homes experiencing a COVID outbreak. There are no workplaces or school outbreaks at this time. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit the number of contacts you have. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering if you cannot maintain a 2-meter distance from others. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. Download the COVID Exposure Alert app at canada.ca. Testing is available by appointment at selected pharmacies and the assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 2 testing and assessment centers, Windsor Regional Hospital, Olette Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you for joining us today. The COVID-19 pandemic continues to challenge the world, with cases increasing at a rapid rate across the globe and in Canada as well. Some countries are doing better than the others when it comes to the cases and the number of people dying with COVID diagnosis. Looking across the globe, we can see how daily confirmed cases of COVID-19 is increasing across the globe. This graph is showing the impact of COVID-19 in selected countries. France, the daily new confirmed cases per million people is increasing at an alarming rate and crossed the 600 cases per 1 million people mark easily. Italy, that experienced had a large number of people dying in the first wave, are now experiencing a very strong second wave with almost 500 cases per million people. And Spain, that experienced the worst case of first wave, is also touching 450 cases per million people every day. UK touching 330 cases per million. US is probably experiencing a third wave given how their curve is progressing, and they're also inching towards 300 cases per million every day. When it comes to Sweden, some people use the example of Sweden's COVID response, and we can see that they're also reporting a surge in cases with daily cases per million similar to what they're seeing in US right now. Among all other countries, we can see that Canada is doing a much better job in managing the COVID-19 due to our strong public health system. The cumulative cases paints a better picture to assess the overall progress. The whole idea of flattening the curve, we can appreciate that how Canada is flattening the curve compared to other developed countries in the world. When it comes to death, the first wave led to many deaths around the world, but when it comes to with the cases increasing around the globe, we can see that the daily new confirmed death is also increasing in many of these countries. Some countries are going in a very dangerous trajectory. Looking at the cumulative deaths overall, the confirmed death shows that the upsurge in countries with the second wave that is hitting is countries like UK, Italy, France. They're also seeing an increase in the deaths among people. Canada is not seeing that yet, but something that we have to be mindful of with the second wave, and with many more people getting infected. The death related to COVID-19 can also increase in our country. So focusing now what's happening in Ontario, our second wave is clearly evident based on this graph, and what we can see is our cases are almost double compared to what we have seen and witnessed in the first wave, and it continues to increase at this time. In Windsor-Essex, our picture looks relatively stable. We are still seeing occasional spikes, but generally we are doing better. But these case counts, the daily average continues to increase at a slow pace in our community as well. Another important way to look at the data is how these cases are being acquired in Ontario, and what is concerning if you compare from the first wave with the second wave is the percentage of cases that does not have any known epilink, or in other words, the people who the cases that are acquired through community transmission. And when we have a high rate of community transmission, things start to escalate very quickly, and that is exactly what we are seeing in Ontario at this moment. In Windsor-Essex, this is what the overall picture looks like. We can see that most of our cases are still acquired as a result of close contact, and some are acquired as a result of community transmission. If this trend changes, or if we start to follow the similar provincial trend with the high number of community transmission, we have to act immediately to contain the virus transmission in the community. I would also mention that we are also seeing an increase in travel-related cases. That is something that we have to pay a really close attention. Last week, we launched our community pandemic alert status with the vision of informing the community with key indicators looking at virus spread and containment, acute care health system capacity, public health system capacity, and incidence tracking capacity. The reason to incorporate all these indicators were to provide a more comprehensive assessment of COVID-19 status in our community. Earlier this week, the province also issued their alert system to provide more information, predictability from the restriction and control perspective. This week, we will try to incorporate both indicators, provincial and local, but we are working to develop a system to present all the indicators in a better way and to avoid any confusion with the different color status of an indicator, either using provincially or locally. So from a virus spread and containment perspective, most of you are familiar with this graph. It shows the 7-day moving average, and our current 7-day moving average is, as of November 5th, stands at 8.1. This is an increase compared to what we have seen in the last weeks, and partly because of the spikes that we reported on Monday, and also with some case counts touching closer to double digit, and signaling a trend about the number that is going up. So it's something that we are still monitoring very closely, and we need the community support to make sure that we can keep it under 5, and that means the risk of transmission would be low at this time. But given what we are seeing with the case count 7-day average more than 5, it is signaling that things can escalate very quickly, and that's why it's presented in orange status. This is a graph that's basically looking at the cases that are acquired in the community with a 7-day moving average, and based on what we are seeing right now, as of November 3rd, 28.6% or less than 1/3 of the cases are still being acquired as a result of community transmission. We have seen some more community transmission earlier on, but now it's trending downwards or relatively stable, and we like to keep it that way. That's why the risk based on that is low and is identified as in the yellow status for this particular indicator. Looking at the COVID-19 hospitalization 14-day moving average, as you can see that since September, the COVID-19 hospitalization continues to stay in a relatively low range, and it's not changing as rapidly, and that's why it's identified as a low risk with a yellow indicator in the graph. Similarly, when we're looking at the active COVID-19 outbreaks in all settings, we can see that right now we have 2 facilities that are currently in COVID-19 outbreak, and based on that number, based on the capacity and the extent and further details of the outbreak, this is identified as a low-risk event for now and has been coded as yellow. Most of you are familiar with this graph. This is showing as the effective median reproduction rate, and based as of November 4th, it stands at 1.18. It's more than 1, and when if you recall, if R naught is more than 1, it means that the transmission in the community continues to happen. With the number of cases that we are seeing today, it will likely increase when the R naught is more than 1. If the R naught is less than 1, that means that the overall transmission and new cases are decreasing in the community. We have seen various fluctuation, but right now we are still more than 1, which signals that the community transmission is happening, and that needs to be contained. And as a result of that, it's coded as medium risk and identified as the orange color in our graph. Focusing more on the acute care bed capacity, and as we can see that our health system capacity currently stands at 87%, and this includes all type of admissions, emergency admission, elective surgeries, and any other type of admissions in our acute care system, which is signaling that it's not exceeding that 90% threshold, which would lead it to very significant concerns. So right now it is in the medium risk category as it's identified, and it's coded as orange in our graph. From the ICU bed capacity, we've seen some spikes recently, but it's still below 90%, which makes the indicator as in low risk and is identified as a yellow color in our graph. From a ventilator bed capacity perspective, we are at 33%, which is again something that is coded as low risk category and classified as yellow. From a public health capacity perspective, what we are looking is we are able to connect with our cases and contacts within 24 hours and 48 hours of the dates it's reported. And between October 27th and November 2nd, 96% of the cases and 97% of our contacts were contacted within 1 day of being reported to public health. So that's why the public health system capacity is standing at a place where we are identifying it's a low risk for the community, and it's coded as yellow. From an incidence tracking capacity perspective, what we are seeing is how quickly that we are getting the results back within 1 or 2 days of testing. And as we can see that as of November 3rd, the percentage of tests that are completed within 2 days, based on the 7-day average, is 87%, which is pretty good. We'd like to see that as close to 100%. So we are there, and that's why it's coded as low risk and it's yellow. From the test being received within 1 day of getting the test done, which is still it's a much lower level that we like to see, and right now it is regarded as a high risk based on getting the results within 24 hours of test conducted. Looking at our overall person positivity by all weeks in Windsor-Essex, in total there were 124,486 tests that were completed, and among those 71,036 unique individuals were tested. And looking at our overall at all tests, our current person positivity is 0.7%, and our cumulative person positivity since the beginning of this pandemic is 2.4%. In the last 4 to 5 weeks, we have seen a change in the person positivity, and our person positivity is roughly at 1% of what we are seeing right now. So a quick comparison in terms of what our pandemic status indicator shows versus what the provincial one shows, and it's just based on some of the information that was shared by the province. There are other criteria, there are other factors that the province may be considering, so we won't code what the province will code us. We will just stick to what we know. So from the weekly incidence rate perspective, in the last week, based on our system and identifying that if the cases are increasing at more than 10 per 100,000 population. We see that as a medium risk because there is still time that we can change some of those instances, and also it takes into consideration whether we are seeing these cases in the congregate setting or the long-term care home or retirement home versus with the cases out in the community. And it changes a lot. If you have more cases even in the long-term care home, from a risk perspective, it may not be as a high of a risk to the community. But if you have more cases or similar number of cases out and about in the community, that poses more risk to the community. So what we are seeing based on the number of outbreaks and based on number of things that we are having a case rate of 13.4. It takes us to the medium risk category just on that particular indicator. But using the provincial definition or provincial criteria, it is coded as yellow based on that. Person positivity, it is the same, and from our perspective it's orange risk, and from the provincial perspective it's a yellow risk. Reproductive number, it's high as I explained in the previous graph, and it will both be coded as orange from the provincial perspective as well as our local perspective. Our local outbreak trends, 2 active outbreaks that are contained, and we have coded as a low risk. And looking at the provincial perspective, it is also as green, which probably is suggesting low risk as well. Level of community transmission, it's stable, as we have mentioned, that it's not increasing, and if the level of community transmission increases, it poses more risk to the community, and it's coded as yellow or low risk of community transmission in the community. The hospital inpatient capacity, similarly, we are identifying as a medium risk. From the provincial perspective, it's stable and it's no longer different, and the rest of the indicators is both coded as low risk for both. The province will formally launch their indicator page. This is what our understanding, by using the most up-to-date data for each of the public health region in the province to confirm our local status. And I don't want to speak on behalf of the province and to assess where we will be based on their assessment, but what we can tell you based on our local pandemic status for this week is orange, which is still a medium risk for our community. And this is based on the factor that our virus spread and containment in the community is creeping up gradually, which is a concern that we need to pay really close attention. And as I mentioned earlier, some of the concern that is linked with is these cases are a combination from everywhere. We are seeing some of these cases in the school. We are seeing some of the cases as a result of community transmission. We have seen some cases in the university, and so something to consider, that we as a community need to take some more action, and we need to contain it from that perspective. But the rest of the indicator system, from public health capacity, from a health system capacity, we are at a low risk. So it's something that we like to see keep it that way. From an incidence tracking capacity, and again, it's a combination of number of factors, but based on how quickly we are getting the results, it's also something that we need to pay close attention to. So as always, recommendations for individuals are stay home if you feel sick or have symptoms, and even if they are mild, and just continue to follow some of those public health measures that we've been talking about: washing your hands regularly, coughing and sneezing in your sleeve, keeping surface clean and disinfected, and always maintain 2-meter physical distancing at all times with people who do not live with you. So that is a key piece that we must remember, that anyone that who do not live with you in your same household, always maintain your 2 meters distance with them at all time, and wear a cloth mask if those distancing cannot be maintained, even for a brief moment of time, and always follow the provincial guidance that is coming and being updated based on the new regulations. So from locally, this is what our local recommendations are based on our medium risk status. You must limit your close contacts to your household members only, and that would help to contain some of the ongoing transmission that we are seeing right now. We are seeing that some of these events are still happening, some of these socializations are happening, resulting in cases identified as a result of those socialization events. Yeah, and maintaining your physical distancing at all time when coming in contact with everyone else. And indoor gathering, as we know, is one of the high risk event, and avoid indoor gatherings with people who do not live with you. So even though some of these socialization that are happening, we know that those are high risk, and especially if they are indoor gathering, that increases the risk significantly. We are also recommending that you should try and find ways to connect with your friends and family virtually at this time to make sure that you are not contributing to the spread or making anyone else sick. As we know, the importance of being physically active is to make sure that how you can do it safely. And most of these activities, what we are suggesting is to keep people active, and also make sure that we're also keeping ourselves physically active and not contributing to the spread of the disease. So in summary, we are assessing our local pandemic status, which is providing a much more comprehensive picture of what we are seeing in the community by considering and incorporating our local situation, our local understanding of the various outbreaks that we are seeing, our local understanding of what we are seeing in each of these situations. And obviously, some of these indicators are also being monitored at the provincial level. We do provide them with some of those updates, but those indicators and those assessments are generally based on the numbers, and our assessments are based on the numbers as well as some of the qualitative information that we have based on our case and contact interview. The current status for us is medium risk, which is obviously indicating that there's a mild increase in the viral transmission, and we have noted that. And even when Teresa is reporting 15 cases today, it's something that we need to be paying close attention to. We do have concerns with the incidence tracking capacity, and we are working to get those results back in a timely manner, but still we are getting the test results back for most of the people within 48 hours, so that's a good sign, but we like to see some of those test results number increased in the first 24 hours as well. We need to pay focused attention in certain areas to address the growing concerns of COVID-19 in the community and to keep our community safe. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Do we have any questions from Blackburn?
You said, we've seen cases from all over the place, and especially in the last week or so, we've had a lot of cases within the schools, single cases, no outbreaks there. But if there were a second case at a school, at the same school, is that when an outbreak would be declared?
So it really depends on the context. So, for example, one of the situations that I can tell you is, if let's say if one student is he or she is a positive case, and then as a result, if they have other siblings and they are being told because of that positive case that, okay, now all of you need to isolate. And when they're isolating, let's say if one of the siblings also come back positive, so the transmission didn't necessarily happen in the school setting, but instead probably at the household setting. So in those type of situations, depending on how we are collecting all that information and getting those details, it may not necessarily contribute to an outbreak, even though you will have 2 cases in the school. And in some other situations, you may also have like completely 2 different classrooms with one student in a classroom with no contact with the other student in the other classroom. And possibly you can have 2 cases in the school with no transmission. The other situation could be you may have one case with in one single classroom with no siblings and anyone else, but anyone else who is identified as a part of their cohort. And down the road, few days later, that student also gets sick, and there is no other possible source of acquisition, then we will deem that as there is a transmission happen in that school setting, and then we will declare an outbreak in that setting. So I think we have to take all of those factors into consideration before we declare an outbreak. So far, knock on wood, we haven't declared any outbreak in the school setting, and most of those cases are contained and identified and are managed currently at home.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. We're noticing that at Roseland Public School, we do have a second case there. Can you tell us what the situation was there? Was it a sibling of the first case, or was it a totally different cohort, considering no outbreak was declared?
It is related to the first case, so it is a sibling.
Okay, thank you.
Any questions from AM 800?
Sorry, Teresa, just to clarify, related in which way? A family member or related through the classroom?
Family member, yes, in the household.
Okay, thank you. I guess, Dr. Ahmed, just with today's numbers, basically like Monday, they're scattered all over the place. Just your thoughts?
Yeah, same concern as I said that, for most of the part, we are getting single-digit cases, less than 5 cases or close to 5 cases. But overall, what is concerning is a gradual increase and an overall average when we're looking at, right? So with the day-to-day fluctuation, it becomes more important that, okay, how do you average it all together and see what's happening? So week-to-week average, if we see from the last 2 weeks, this week average is high, and this is pointing out to the concern that it's not as bad still, but transmission are happening and people are still engaging in some of these activities that are leading to these transmission. We are getting some information based on our case and contact interview as well that people are still having some of those social gatherings, even though the gathering limits have decreased significantly. Gatherings are still happening, which is against and the violation of the Reopening Ontario Act. And also it is leading to more people identified as a result of close contact and being part of those events. So we are trying to put all those information together to see if there's any other type of cluster that we are seeing right now. So some of those information are still also considered, but we want to remind our community members to please, as much as I personally myself want to go and have many of those socialization as well, but we all have to be very, very responsible at this time, and we cannot let our guards down. We cannot let an increase in the number of cases in our community and can potentially lead to many of the things that we are having right now in a reduced phase or having more restrictions in our region. We'd like to keep that balance of ensuring that everyone is healthy, the case or the COVID transmission in our community is contained, and also we are having all of those economic and social activities in a safer manner. And all of us have our part to play, and I would just caution that we are in that stage where we are seeing those changes, but we can still change it. So before we get to the point that it's already widespread and we need to talk about extreme measures, we need to contain it right now.
Any questions?
The data that you're seeing, are you concerned we could have a third cluster?
Not at this point. I think it would be too early, but what I can tell you is yes, some of these events are definitely happening, and that's why some of these close contacts are being identified. We are putting all those pieces together. It would be too early for me to say that this is a cluster at this time.
Okay, thank you.
Any questions from CBC?
Yes, good morning. We're seeing some pushback against the quadmester system in secondary schools. We wrote an article about that. We're basically seeing students saying they don't like this, having the semester broken up into 4, education experts saying it's not good for the students. And given that Windsor-Essex new case counts are quite low, is it necessary to still maintain this system in high schools? Is it maybe time to abandon the system and go back to a more traditional learning model? What do you think? Is it safe to do that?
So I would not try to be an expert in the education system. I would stick to my role and as the medical officer of health and a public health specialist. Some of these, obviously, these are the questions that the educators need to address. From a public health perspective, obviously, what our recommendation is, keep your number of contacts low, and follow all those public health measures and guidelines when we are talking about it, especially the cohorting that's been introduced. So as long as all of those measures can be implemented in a safer way, it's not my place to say whether it should be quadmester or whether it should be semester or however they want to do it. There are certain criterias and parameters given to the school boards, and they are in the best position to know how best to create that learning environment and to balance that need from the teachers based on the resources, classroom availability, and everything else. So I'm not in a position to comment on that, but I can say that the public health guidelines and parameters are very clearly identified, and it's up to the educators that how they find the best way to teach.
Okay, thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from Windsor Star?
No, thank you.
Any additional questions from AIM 800?
Teresa, I have a question, non-COVID related. Just wondering if there's any updates in regards to the safe injection site in Windsor-Essex. I know you spoke about it in September. Just wondering if there's any updates.
The update I can give you is that we have met with our Consumption and Treatment Services Advisory Committee to look at next steps. We do want to move forward and likely will engage the assistance of a real estate agent, working with our staff to look at some, potential sites and then move from there. But we are moving forward, but that's the most current update right now.
I guess since September to now, has any expressions of interest stepped forward at all?
No, we did not receive any interest from the expression of interest, and since then, no one else has brought forward a potential site. But so we'll actively work within the area that is deemed most in need, and as I said, we'll engage the services of an expert that can help with that process.
Thank you. No, it wasn't COVID related, but appreciate that. Have a great weekend.
You too.
Any additional questions from CBC?
No, thank you.
Thank you, everyone. Have a great weekend.